Hey there, this is Dr. Evan Osar with Discover IMI, Integrative Movement Institute. Happy Tuesday. Hope your week has started out well. I got a question from a student about low back pain and working with clients or individuals using the Jefferson curl. If you're not familiar with the Jefferson curl is when you load end range spinal flexion. The thought being that if you strengthen individuals in those end range positions, then you give them protection from low back pain. Is that a true statement? Possibly. Okay, so Jefferson curl looks like this. You grab some resistance and you have them basically do full spinal flexion, so they're standing on the edge of a bench or step or platform, and they'll do spinal flexion all the way down and go into end range spinal flexion. Now, the theory is, as I mentioned, that it will strengthen those muscles that protect you in those end range positions. And potentially that's a true statement. If you have an individual that doesn't have prior history of low back pain, spinal surgery, spondylolisthesis, disc herniations that don't respond well in the flexed spine position, so if you've ruled out all those things, I should say, and they also have optimal spinal flexion from each region of the spine, meaning that when they flex their chin and flex their neck, I should say flex their head and flex their cervical spine and flex their thoracic spine and lumbar spine, and then they have good end range anterior pelvic rotation, because you need good end range anterior pelvic rotation, and they have a good breathing strategy, an optimal breathing strategy and core stabilization strategy, then that end range position may be beneficial. Now the question is, how many of your clients actually have all those, can check the checklist of all those components? Optimal spinal flexion in each region of the spine. Optimal anterior pelvic rotation, meaning they have length in their posterior chain to get optimal anterior rotation of the pelvis to load the posterior chain appropriately. Optimal breathing strategy to create the optimal intra-abdominal pressure to stabilize the spine in that position. Optimal core stabilization, so they have good protection around their spine in that end range position. And they have the motor control to go down and get back up and don't have those underlying pathologies. That's the question you want to ask yourself before you start doing these exercises that you start seeing on the internet, because we know the internet has all the answers. And again, don't take my word for it. Do your evaluation on your client. Take their history so you understand what issues your client is dealing with. Do your assessment so you see what your client has available to them and what things you may need to improve. Is there a region of their spine you may need to do some more mobility work in? Is there a region of their spine that you need to do some more stability work because they have too much motion or compensatory motion in that region? Teach them how to create an optimal hip hinge to get length through their posterior hip so they can get optimal anterior pelvic rotation. Teach them mobility work so they're able to go into cat and camel position and have good spinal mobility so they can actually maybe do that position before you start loading those end range positions. Because the challenge is there's a high risk, if your client doesn't check all those boxes, that they will get some injury in those end range positions. And to me, it's not worth risking my client in those positions unless I've checked all those boxes. And even then, I'm going to be very, very cautious of them in those positions. So can some people tolerate that position and or benefit? Absolutely. Should everyone do an exercise like that? Absolutely not. So one of the things that we want to provide you with here at Integrative Movement Institute is the tools, or are the tools that help you make the best decision for your clients. So we're going to teach you about some of these spinal conditions that your clients may come in with, or hip conditions and or shoulder conditions like labral tears and or rotator cuff tears, like hip impingement, like spinal issues like we talked about, spondylolisthesis, disc herniations, and things like that. So you understand these components, and then you can use your assessments. We're going to teach you assessments to use with your clients so you can determine, are these strategies appropriate for your clients, as well, or what are the best corrective exercise strategies to help your client address what you found during their evaluation, and then how do you integrate these components into the fundamental movement patterns. So pushing, pulling, bending, rotating, squat, lunge, and stepping type patterns. So you have the best strategy for your client, and more importantly, not just a group of exercises, or not do this, don't do this, but how do you evaluate your client, and can you, from your information, from their history, from the results of your evaluation, and from what you know about anatomy, biomechanics, and motor control, create the best program for your clients. That's what the Integrative Movement Specialist Certification is all about. We're doing Level 1 Foundation live. We only have 9 spots for our live course, because we're doing it in our office in Chicago, downtown Chicago, Illinois. So you'll be with myself, as well as our trainer who's been with us for 16 years, or probably 17 years at this point, Sarah Fisher, and as well as my wife, Janice. So we're gonna take you through this process. So when you leave, you don't just have a group of exercises that you can do this for this, or do this for this other condition, so that you have a thought process, a systematic thought process, because you'll only rise to the level of your systems, and you fall to the level of your systems as well. So we want to make sure that you leave with a thought process, a strategy, as well as a way to look at your clients and help them create the best exercise strategy, because we know that exercise is medicine. So we want to make sure, just like you take the proper medication, the proper dose, that you have this information that will help you make the right decisions. I put the link next to this training coming up in September, so just a few weeks away. Like I said, we only have 9 spots. That's all we have space for in our office. And again, you'll be live interacting with us, and we'll give you both study material before you get to the course, as well as support you after the course. If you have any questions, feel free to put them in the comments here. And we look forward to seeing you in Chicago. And if you can't be live with us in Chicago, we'll be doing an online version of the course later this year. So any questions, put them in the chat. Thank you again for being part of our community. Thank you for all you do for your clients by helping them understand the power they have inside their body to make informed decisions about their health and well-being. Again, if you have any questions, any way we can support you, please reach out. This is Dr. Evan Osar with Integrative Movement Institute. Have a great Tuesday, and we look forward to seeing you in Chicago live in just a few weeks. Take care. Hello, Pete Rizzle.